This is a huge problem in our country with so many people being medicated for so many different things. Why are teens doing this? Is this because it's easier for them to get to these drugs than perhaps other drugs?
Well, indeed, it is something we take rather casually. It is available in our own home, but the fact is it's a serious problem. I mean, just listen to some of this data. 2,500 12 to 17-year-olds will abuse a prescription medication for the first time today. 12 to 13, amongst 12 to 17-year-olds, 65% of them say they get these medications from their friends and family. And in my field, in addiction medicine, we're really seeing just a tidal wave of consequences, both addiction and lethal outcomes from young people using these medications.
Yeah.
We've done a pretty good job improving the use of illicit drugs, but we're losing ground here in prescription medication.
What are some of the myths that perhaps teens have about using prescription drugs?
The biggest myth they have really is that there couldn't be anything wrong with this, their casual attitude towards it because, hey, it's been in the medicine cabinet, I took it after a dental extraction, a doctor prescribed it, it must be safe. Or they're not aware of the fact that over time you can develop tolerance to the intoxicating effect, which they are aware of, but they're not aware that you may not develop tolerance to the lethal effects of the drug. By the same token, they're not aware of the potential consequences of mixing and matching. I think everyone's aware of what happened to poor Heath Ledger, a life cut short before it began because of inadvertently combining medication that the doctor prescribed.
Of course, getting parents in on this is key. What do you tell parents about the signs that they should be looking for when it comes to their child? Obviously, maybe for me, I would think, you know, parents might even notice that there are fewer and fewer pills in the medicine cabinet.
That actually is one of the later effects. Early on, in fact, the parents do need to get into this very much. The first thing is to say, don't ever say to yourself, not my kid. The second thing is to be aware of the common symptoms and signs of many psychiatric conditions. It's hard to ferret out prescription medication abuse or addiction from other psychiatric conditions, but the signs are a drop of grades, a change of dress, change of sleep pattern, appetite patterns, mood lability, irritability, agitation. These things are signs of mental health disturbances, and at that point you really want to enlist the school's help. In fact, the Smart Move, Smart Choices program that I'm representing this morning is presented by the National Association of School Nurses with Pricera on their website at nasn.org. If you click through on Smart Move, Smart Choices, you'll find a wealth of educational material and videos that you as a parent can access, you can refer your kids to, or watch with your kids. There'll be testimonials on the site from other young people who've been through these problems, and it's a way to really begin to raise awareness and begin to address this thing that is threatening the young people's health in this country.
What are some of the differences between and is there a difference? You work with addicts, you know what they're like. Is there a difference between a teen addict and an adult addict?
Well, yeah, an addict is an addict. I think the main difference, there's two main differences for me in working with teenagers. One is that they're more difficult to treat. They're more difficult to get into a sustained recovery program. So many times we spend most of our time just trying to educate them and keep them safe till they mature to the point that they can do the hard work of recovery, which requires a certain amount of maturation. Secondly, one of the things that I think people should be aware of, people can be strung out on hardcore drugs like opiates and benzodiazepines and not have withdrawal in adolescence. The strange thing about the adolescent brain is sometimes they can stop a thing like heroin, have no withdrawal.
Oh my God.
We don't know why that happens, but it's a very strange thing. So the on again, off again with hard drug does not mean they're not addicted. Not because they're not having withdrawal, but because they're having continued use and consequences and a family history of addiction. That tells you you're dealing with an addict.
Wow, this is serious stuff. And again, for parents who want more information, www.nasn.org. Dr. Drew, thank you so much for giving us such good advice and talking about it. We certainly learned some new stuff today. And
it's my
hopefully
pleasure.
We can get our hands around this problem. Thank you so much.
Thank you.